Welcome to the Coalition Conversations, Amplifying the Employer Voice. This is a podcast series designed to highlight organizations that are innovating to bend the cost curve and improve the member experience in specific clinical areas. The GPBCH Coalition Conversations podcast series number 2 is around oncology. It is a series that focuses on cancer care and ways innovators and employers are partnering to guide members along the continuum. Our first episode in this series highlighted Skin.io, an innovative technology helping members with assessing and diagnosing skincare risks. Today, we bring together two friends of mine for a session we are calling the Cancer Care Conversation, Empowering Employees Through Information. Our conversation will focus on how employers are providing members with accurate and actionable information to guide their journey and give them and their caregivers more knowledge, which translates to the power in understanding and guiding their journey. I am so happy to have two people who I like and admire because they both lead with their hearts. And I just realized I recorded that, so now I'm on record as saying something nice about Pat. I always speak nicely about Aileen. So welcome, guys. Nice to have you here. And looking forward to this conversation. Aileen, did you just want to introduce yourself, maybe talk a little bit about your role at Essity, and we'll go from there?
Would love to. So at a very high level, my role is really about supporting our employees so that they make confident decisions about their benefits and their health. I oversee the U.S. benefits program for my company, which is called Essity. And my focus is, yes, it's making sure that our benefits program is competitive, but it's also about making sure that it's easy to understand, that it's accessible, and that people are actually, the benefits are actually helpful when our employees need them. Because at the end of the day, the benefits are only as good if the people know how to use it and use them well. So I spend a lot of time thinking about how we can support our employees through our benefits program, and whether that's really, trying to stay healthy, doing preventive care, or whether it's through a very difficult, serious medical condition. And that really ties into Essity. We are a global health and hygiene company, and our purpose is to break barriers to well-being. So in a sense, my role is to bring that mission to life for our employees.
That's great. And we'll have a conversation about, but just figuring out, when do employees get the information? How do you make it available to them just in time? How do you make sure they are aware of what's there? Because there's so much. So, and Pat, I know you're over at NCCN, but maybe tell people, because it is one of the best kept secrets in the industry, especially for employers. So maybe talk about your role there, how you got there, and a little bit about NCCN.
Sure, thanks, Tom. So I'm with the National Comprehensive Cancer Network, or NCCN for short. We are an alliance of leading academic cancer centers across the United States, here in the greater Philadelphia area. Two of our members are the Abramson Cancer Center and Fox Chase Cancer Center. NCCN as an organization develops and distributes what have been referred to as the global gold standard of clinical guidelines in oncology, where we really pool the time and talent of these cancer experts from across our 34 institutions to develop these guidelines. As you know personally, I'm not smart enough to do that work, so in my role I have the privilege of serving as the executive director for the NCCN Foundation, where we are charged to develop and distribute community-friendly versions of these clinical guidelines, so really taking the core content of the clinical documents, but adapting them for a layperson audience so that you don't require an advanced degree to understand what type of cancer you may be diagnosed with, how is it treated, what your options are, questions you can ask your care team. So in our role at the NCCN Foundation, we're really transforming this clinical content into community-friendly information. We feel information is not only helpful and power, but it's empowerment to allow individuals to participate in shared decision-making. Additionally, we also support a small but mighty young investigator research program where we support junior faculty members across our institutions to ensure that next generation of investigator is getting a good, strong start to their career. How I got here, besides you inviting me into this conversation, I'm a 25 plus year nonprofit professional. I've been working predominantly in healthcare related charities, but cancer is near and dear to me. Been with the organization a little over 5 years, and really just love the impact that we're able to have with the collective cancer community, clinical, individual, and beyond.
I know we're not going to get into it today, but you were gracious enough to invite me to one of your events, and I got to meet one of your early career researchers, and it is just amazing the work they're doing and just how committed they are to, finding cures and finding good information out there. So
Yep.
Kudos to you guys.
Thank you.
So, not to make this sound like a dating service, but how did you two first meet?
Actually, we met a few years ago in 2023, and that was at the Coalition's Oncology Summit. And that's where I was introduced to the NCCN patient guidelines. And what really struck me about the guidelines is how easy to understand they are, particularly when cancer is so complex. I also thought it was great that there was a mobile app to actually make the information more accessible to individuals, especially during really stressful moments. You don't know what to do, but to have it on your phone, to have it in a mobile app, makes it so much more convenient. So I had actually reached out to Patrick after meeting him at the Coalition, and I asked him to be a guest speaker for one of my webinars. I do health literacy webinars quarterly for our employees, and my goal was to take our employees through the cancer care journey from prevention to diagnosis, treatment, and then obviously as well for ongoing support for patients and caregivers. And he graciously accepted. He was the guest speaker. He talked about NCCN's mission. He really highlighted how easy to use the guidelines are. He went through the other tools and resources that NCCN provides, the mobile app, there's webinars, there's a whole plethora of different tools and resources. So that was just a wonderful way that we got to work together. But it became much more personal for me. Last year, I was diagnosed with stage 4 non-small cell lung cancer. And the very first thing that I got from my oncologist was a copy of the NCCN guidelines. So it became very real for me. And I really experienced firsthand how invaluable that information it truly, truly is. It gave me something reliable as I was being diagnosed and going through testing. Everything was just so overwhelming. But having those guidelines helped me to understand my condition, know what questions to ask, know what to expect during my treatment. So I wasn't really totally overwhelmed. And I was able to share the guidelines with my family, with my friends, my caregivers. So in a sense, it really helped them to support me. They knew what to expect as well. And they didn't really feel like they had no idea what was going on. And I thought that was really, really helpful. So that's when it clicked for me that those guidelines, it's not really just information. It's something that people can truly lean on and truly use, especially during that dark moment in their life.
It's an amazing story. Every time I hear it, I'm blown away. And I think it's interesting, you got involved with Pat and NCCN before it was a personal time for you. How, maybe going back a little bit, how did, like, from your employees' perspective, what kind of impact has the introduction of NCCN? And I know you do work with other, like ACS and some other, so how has that impacted your team? And, I think the one thing we'll probably talk about throughout this is the just-in-time nature, because nobody pays attention to anything until it's personal.
That's so true.
So,
I was thrilled with the amount of people that actually attended that webinar. We got a really great turnout for that webinar. And immediately after that webinar, I had a ton of my employees reach out saying that the mobile app was amazing. I had people who had been recently diagnosed telling me that it was just at the right time. It really helped them to understand their diagnosis. It really helped make a difference. So I was just absolutely thrilled that one, these guidelines are free, and they're amazing, easy to understand. It's been a godsend, not just for my employees, their family members, my family members. I try and spread the news about how wonderful these guidelines are.
And so, Pat, what, from your perspective, like going on the website, and again, I've been in the industry for a long time and really hadn't been exposed to NCCN, and that was recorded as well. That's great. So just, it's amazing when you go onto your website, and you were nice enough to give me hard copy because I'm old. So like, how are you getting the word out? And maybe before we go there, talk about like kind of the plethora and the different guidelines from a patient perspective that you have across the continuum.
Sure. First off, how do I follow Aileen? I mean, she's great, right? But I did want to just shout out at your initial question to Aileen earlier. We met because of the coalition, so we truly are a success story of the value of this coalition and the ability to bring members that are more corporate in focus with the nonprofit community, who, by the way, also a member now. So kudos to everybody. So really, what's the unfortunate reality, and you touched on it, we're like a best kept secret. You said this earlier, right? And that's not a good thing. It's fair to say that if you worked in oncology on a clinical side, you know about NCCN, and that's reality. If you're not in oncology, you don't know about the foundation and the work we do on the patient education side. And that's just a travesty, because the information, again, echo everything Aileen just said, just hit repeat, right? But way people find us, we work very closely with healthcare, not only our own member institutions, but any and all private practices, healthcare systems, cancer centers, whether they be academic or community. We really try to push the word out. We also work very closely in the patient advocacy community or other nonprofits who are in the cancer or cancer adjacent space. We have working relationships with over 270 advocacy groups, varying degrees, but where they're helping to get the word out, because we're a content organization, but we're not patient facing. So we really need healthcare and advocacy to help us do that. Word of mouth has always been a trusted ally, but then something more recent we've been doing, largely inspired by the work of the coalition and why we've been working with you and the team, is employers are a great outlet to educate large systems of individuals that are facing professionally and personally cancer on different levels. So we've really I actually hired a full-time person about 8 months ago who's working in this space to help introduce these resources to more Aileens in more organizations. The resources themselves, to your follow-up question, Tom, is we have a library of books. Now, these are not 6 or 8 panel brochures. These are truly comprehensive books that range 40, 50 to over 100 pages. Digitally free of charge. You can order them through Amazon for a nominal fee. We don't have an inventory, I'm sorry to say, but and these books are, right now our library includes 77 titles. Most of the books are in cancer-specific treatment topics, so 57 books that will address this type of cancer. How is it treated? How is it diagnosed? Specific questions you could ask your care team about that particular cancer. But we also have 5 books currently in the screening, detection, and risk reduction space that I would think that your employer members would very much appreciate, trying to mobilize the teams to take advantage of their benefits that are likely included in their benefits programs. And then we have 13 books in what we call supportive care. These are books that complement the cancer journey during and beyond treatment, so it might include does include things like nausea and vomiting, distress management, palliative care, survivorship. So in all, we're at 75 books today. Proud to say we'll be adding 2 new books by the end of this year. We're adding an older adults with cancer book in September, and then we'll be adding a new resource for caregivers, a horrifically under-resourced population who do such wonderful work and don't take care of themselves. So we're excited in October, just in time for November's National Caregiver Month, we'll be launching our new patient guideline, which will be in the caregiver space.
That's amazing. I know when we were at our oncology summit just recently, and For Pete's Sake was there, and just the whole idea of respite care and the opportunity for caregivers to get together with other caregivers to really understand, and people who would understand what they're going through as well as what the patient is going through. Pat, you talked about the 77 guidelines, and I think the one thing that was eye-opening to me is it's not like you produce a guide and it goes on a shelf for 10 years. So maybe talk through the process of how you're updating these on a regular basis for what is a very fast-moving area in oncology.
Sure. So by design, everything we do at the NCCN Foundation is and must be funded through charitable support. So what I do in patient education, what I do with young investigator research grants, not a line item in the NCCN budget. So we sometimes are limited by reality of fundraising, but the way the content flows on the patient resources, all of our patient content will originate in an NCCN clinical guideline. That work is done by thousands of experts across our member institutions who volunteer their time every year. And they're updated at least once a year, more often if there's practice-changing advances in therapy. Again, because we're charitably funded, we've made the commitment at the foundation we will update every year. That wasn't the case when I took this job 5 years ago. We were updating sort of as we had the funding. So there were some resources that I'm embarrassed to say were several years on the shelf, but today, 2026 is the first year we've launched and our commitment to updating every book, every year, the same month every year. So from a planning purpose, all of our partners, employers and otherwise, know, oh, that book's going to be updated this month if you're doing any type of health literacy communications or campaigns or Cancer Awareness Month activities. But then in addition to that, we've also committed to helping to break down some of the access barriers from language. And while we've always worked to try and translate our resources into other languages, over 200 translations today, we've made the commitment also that with these annual updates, we will update a Spanish version every year. And I'm hoping that Spanish is the first of many languages that will operationalize into this commitment.
It's fantastic, especially for employers as they're going globally. I know, Aileen, your responsibilities expanded globally, and it's nice to have one resource you can go to.
The Spanish translations are in the nick of time. We're growing our Spanish-speaking population, so we've gotten some acquisitions. And so we're really being intentional in making sure that all of our benefits information is in other languages. So being able to tell them that they had resources to make it easier for them was invaluable.
Wow. So Aileen, I know you've been very open about your journey, and which I have so much admiration for you. You talked at our conference about your care team, and just you have a big care team. So between adding the care team, the different resources that you're being asked to tap into, I think we talked a lot about coordination with your PCP at our last session, but maybe talk about, like, as you've navigated it, you got into this a little bit. What's been good information for you to have and to feel empowered through this journey with a big team at your back, but also a lot of voices in your head? How did you navigate that, or how do you navigate that?
Well, I will tell you that my care team does meet. They work hand in hand together. It starts with my primary care physician. She's the one who really pushed me to get the testing, to the x-rays and everything. And she's the one who coordinated everything to make sure I got to the specialist just in time. Like, she didn't make me wait. She made me an appointment. As soon as she got my results, she made the appointment the next day. And they all work very well together. I will say, I told you that I got from my oncologist a copy of the guidelines. They said this is the gold standard. And they also told me that there's no such thing as a bad question, ever. So don't ever feel afraid to ask for anything. So for me, it's making sure that my entire care team, they're very good at all keeping each other informed. They share the information internally. They have their meetings to discuss if anything changes. So I recently just had a PET scan. I got the results actually yesterday, and there is more growth in my left lung. And I see my pulmonologist tomorrow. He's part of my care team. He gets a copy of it. So I'm sure he will be discussing everything with me, talking to my oncologist, my radiation oncologist, because we're very hopeful that rather than going on chemo, I can take radiation. I do have a mutation. That mutation, one of the things that NCCN Guidelines tells you is when you get diagnosed, get the biomarker testing, the mutation testing, because there may be targeted medications that you can take before going to chemotherapy, which, chemo kills everything. I take a medication, it's one pill once a day. It's very targeted for the mutation that I have. The guidelines actually explain all the different mutations there are for the type of cancer that I have. And I'm hopeful that I can stay on it, as well as add more treatment to hopefully really just target where they're finding the spread. It's a lot of information. I feel like the guidelines really help because they simplify the information that I get. You get your scan results. There's all these big words. But I feel like the guidelines really, there's a glossary in the guidelines helping you understand some of the terms. And what is also really helpful is that list of questions. So it kind of says, if this happens, here are some questions that you can that you can ask your doctor, your care team. So in that sense, having those guidelines and having a team, you really want to also have a team that you feel like you can talk to. Um, that those are the two most important things. And information is so powerful. The one thing I will say is that information didn't change my diagnosis, but it changed my experience with cancer. Being knowledgeable, knowing what to expect, it made a world of difference for me.
I've heard a lot of folks who are going on a cancer journey, they get recommended to a physician and they just take that physician. Um, and I think you and I spoke about just, if you're not comfortable with the person who's going to take you on this journey, you need to be your best advocate.
Absolutely. I I feel blessed. My oncologist, he told me very upfront, the very first meeting, I have no ego. You can get a second opinion. I encourage it, if you want to know what else is out there. But I will be very honest with you. I will work with you. I don't treat just your body. I do believe in a more holistic approach. And it really fit me. But we do have a second opinion program in our benefits, and I used it. I just wanted to make sure. I think it is always really important to get that second opinion. If it's in your benefits program, take advantage of it. But I feel like you'll know when your care team is right for you because you can speak honestly, freely, and you feel supported, and there's no judgment. So that's how I know I have a really great care team.
That's amazing. I know we're probably running out of time, but I did want to just go back to something you said, and I know we've talked about it a couple of times, and Pat, I wanted to get your feedback on it, is really the biomarker testing. And, I know it blows my mind. There's some controversy around that with now some Medicare decisions and things like that coming in. But Pat, you were sharing earlier, something that you're going to do in the fall with making people more aware of what this is, how it works, and maybe talk a little bit about that.
Sure. As you might imagine, in our clinical guidelines and therefore in our patient guidelines, you'll hear about a number of things: clinical trials, second opinions, and you also hear about biomarkers. And again, on the foundation side, our role really is to help educate the population that maybe not be as familiar with the cancer world. So one of the things we do, as Aileen mentioned earlier, we do provide virtual webinars that are hosted online where people can sign up and attend in person or view the archive version on our website. And we'll be doing one this fall on biomarkers. It's going to be sort of a 101. We'll bring in a panel of experts from amongst our NCCN member institutions. We usually bring in a physician, a nurse practitioner, nurse educator, and then we always involve a patient advocate because we want to make sure that the patient's voice is included. Sidebar on that, these panels that develop the clinical content, very proud to say that 98% of our panels include a patient advocate. And that's not just a box that's checked. They have an equal voice and an equal vote with the 34 physicians and experts that are around the panel. So this is a big commitment, and I'm very proud of my employer for making that commitment. But this webinar will be hosted at a level people can understand. There's Q&A can be submitted through the chat so that the panel can respond to the questions. And as I mentioned, we do record and archive them for future viewing. So if you can't make that date and time yet to be determined, but we'll be able to view it at a later time.
That's great. Any final thoughts for as we're thinking about employers and the message we want to get out to employers about the guidelines, how to best work with NCCN? I think, Aileen, from your perspective as somebody who's used the guidelines and also provide them to your employees, what's that word of advice? So Pat, I'll give you the first word. And
Sure. I guess I have a couple answers for you, Tom. I'd never give you just one. All right. So the short response is, and you heard Aileen say, we have these resources. We feel they're very valuable. We have over 2 million people used our patient guidelines last year globally. They are free. I want to stress the word, they're free to employers for this type of engagement. I would encourage employers, as you're looking at what are the resources you want to provide to your workforce, what are the resources you need to incorporate into what you're already doing in the cancer space, consider working with NCCN. It's free of charge. We are a nonprofit. We're able to do that. And as I mentioned previously, I have now a full-time position helping us introduce these resources to employers. The second thing I would just like to encourage is, so reach out to me. We're members. I'm in the directory at the Coalition member database. But the second thing I just want to mention and kind of pick up on the care team. Employers can be a critical member of that care team, whether you are a coworker, whether you are a manager, or whether you're executive management. So not only looking to work with organizations like NCCN, and there's a lot of us doing really good work in this space, but also look at how you resource your colleagues that are not the patient. Perhaps they're the caregiver for a spouse or partner that's been diagnosed. Perhaps they're a colleague or manager. There's ways to support your team so your team collectively can be a member of the care team for that employee that is either the patient or has a loved one who is.
That is such great advice. I know we've had conversations recently at different conferences, whether it's menopause or some other diagnosis, cancer, like as a manager, how you just ask somebody, hey, how are you doing? And just listen, or at least, to your point, have the information to, understand what that person is going through. And you'll never understand unless you're in their seat. So that's great advice. I am shocked.
All this has been recorded, my friend. I want multiple tapes of this.
All right, Aileen, last word.
So if there was one thing I would want employers to leave with, it would be this, that access to clear, trusted, reliable health information really does change outcomes. So when people are overwhelmed, if they don't know what to do, they're less likely to take action and less likely to be fully engaged in their care. We know health literacy is a really big problem. It's also one of my passions. So when you have information that is clear, it will help someone, take action earlier. It will help them better understand their condition and their treatment. It will help them feel more confident in their decisions, and it reduces a lot of the fear and anxiety that they experience. So it doesn't just affect the patient, it affects their families, their caregivers too. So when you're providing resources such as the patient guidelines, it's not just another benefit, it's just not another booklet. It's about giving people something that they really need at that really dark time in their lives. It's about giving them a sense of control and hope. So I hope that employers will realize that information is key and information really does help change outcomes.
I think you make such a good point, and it's good information. The Dr. Google stuff is just, I mean, it's dangerous, and you can go spiraling and not realize, hey, there is a path for me. So
Yeah.
there is hope.
Yes.
Well, Pat, I so appreciate you being here and the time you spent with us. Aileen, I think you know just how much I adore you. So thank you.